Hello and welcome to this Africa Day, CNBC Africa special. I'm Chris Bishop. And what a different Africa Day it is this year, with the continent in the grip of COVID-19. On this program, we hear from three influential and strident voices on the continent about how they feel Africa can come up with a unified and coordinated response to the pandemic on both the private and public fronts. We start with South Africa's Minister of International Relations and Cooperation, Naledi Pandor.
There are several aspects. Firstly, that we should, as Africa, regard this as a public health emergency, and therefore it's vital that we work with the African Center for Disease Control. We've all said it's important that science and data inform the strategies that we adopt. So the coordination really is from the African Union, and we derive advice from the African Union Commission. As ministries, we're in constant contact with the regional centers for disease control, as well as the Continental body based in Addis Ababa. We're working together on the sourcing of equipment that is necessary to support health workers and the civilian population. We agreed right at the beginning that it was better for the continent to procure on a continental basis rather than individual countries securing support with help through health equipment. So we've been sharing mask procurement, providing help where we can with respect to ventilators, advising each other on strategies we've adopted. If you look at what each of the countries have done with respect to restrictions, you would see that there's a great deal of similarity, including provision for social relief measures for persons who've been impacted because of the economic aspects of the restrictions.
Minister, at a time when the continent's celebrating Africa Day, how much do you think this pandemic has been a test of that cooperation and African unity?
What has happened is that we have had to be in much more contact on measures, on strategies than we ever would have been had there not been a pandemic of this kind. So when we discuss, we're actually looking at what are we doing? How do we do it better? I think what the pandemic has done is starkly alert each country to the need to much more robustly attack aspects of inequality, and also look at the capacities within public institutions and their ability to assist governments to respond to public emergencies. The health sector has stood out as one in need of real support. We've had, I think, amazing contributions by health workers. It's been important how many of them have come forward and really given of themselves. So clearly there are sectors that we need to ensure we give greater support to. We also must address infrastructure gaps. We've had to put up hospitals, which will be satellite hospitals that will just be available for this period of the emergency. But clearly, the key issues are the need to address the inadequacies and the inequalities that are prevalent on our continent.
What about private business? How have people like yourself in government tried to bring private in to work with the states in fighting this pandemic?
Well, several things have happened. Firstly, what we decided right at the beginning, with the leadership of President Ramaphosa as chair of the African Union, was that we needed to establish an ability for Africa to assist other African countries that may lack resources to respond immediately. So we agreed through the Bureau of the African Union to establish an emergency COVID-19 fund, which African countries made contributions to. We also agreed that as governments, we need to strengthen the African Centers for Disease Control so that the science could be supported to help us to react more effectively. So funding has been directed at the CDC. Over $60 million has been contributed by different African countries and the African Union toward the CDC. The COVID-19 fund has had the support of the business sector on the continent. A special meeting between the Bureau and businesses, leading businesses on the continent, has been held. And we've been able to secure their support in the work that we're doing to prepare for the post-COVID period, particularly with reference to economic recovery. So institutions like Exim Bank, African Development Bank are ready, either with credit guarantees or access to loans that would not be high interest loans for countries that would need support post the pandemic. So businesses really, I think, come to the party, and the African Union leaders have asserted that we will work very, very closely with them to assist us in addressing the key issues. Finally, a group of envoys have been appointed by President Ramaphosa to work with international finance institutions. The envoys are made up of former finance ministers, as well as leading business persons from the African continent. Their task is to speak to the World Bank, to the IMF, to international partners, to really assist in securing the promised resources that will support the continent to stimulate economic activity once we're able to focus on areas that have really been in decline due to the restrictions that we were compelled to implement.
And as we come around to celebrate Africa Day once again on the continent, what do you think is the greatest problem facing the continent right now in terms of this COVID-19 pandemic?
There continue to be many, many problems. I think the first one is we must be prepared for when the peak comes. As you all know, at the moment, the numbers may seem very low on the African continent. Some have infections in the hundreds. We in South Africa, of course, have begun to see a very definitive increase in infected persons, but we are all being told that the peak will result in around July, August, when winter has set in. So we must ensure that we are ready so that our populations are not decimated by this disease. And so having protective personal equipment is vital, ensuring that we have a sufficient number of ICU beds in our hospitals, setting up field hospitals and all the facilities necessary to support our populations would be key. Second is to look at our production sectors in our various economies and really begin to identify opportunities that we may not have drawn on previously. So our manufacturing capacity has proven to be very inadequate. We're not able to produce sufficient numbers of masks. We're not producing ventilators in all parts of the continent. So really paying attention to the plans Africa has on industrialization and manufacturing stimulus and growth is another area that I think we should give attention to. Making sure we have a proper return to full democracy and that the restrictions don't become a permanent part of our lives, except, of course, those aspects that ensure we as individuals and society care for ourselves properly would be another aspect. And then proceeding with issues of good governance, making sure we build effective public institutions, and that we support the population which has been so impacted by the decisions that were necessary.
And lastly, Minister, very briefly, your government here, as well as other governments across the continent, have been under a lot of pressure to reopen the economies very quickly. How difficult is that decision to make right now?
Well, I think it's very tough. Being a member of the National Council on COVID, I think you keep having to ensure that you're very balanced in your approach, but the key issue is saving lives. So yes, you're buttressed from left to right, that you're neglecting the economy. When you seek to open up parts of the economy, you're accused of placing lives in danger. So we've had to find a balance through which we would have a gradual opening up without detracting from the successes we've had in keeping the numbers low in South Africa. So as we approach Africa Day, the duty of African governments is to ensure that we protect our people, and those who are infected must be assured that we will provide them with the necessary health support and with measures that would continue to ensure they have a livelihood.
The Africa Continental Free Trade Area is certainly something to think about in these difficult days of COVID-19. How is the dream of more trade and fewer borders in Africa going to make it through the pandemic? Well, we spoke to one of the curators of this dream, Wamkeli, the Secretary General of the African Continental Free Trade Area in Addis Ababa.
COVID-19 has placed a significant barrier on our the implementation of the African Continental Free Trade Area. Countries have closed their borders. Trade, even normal trade across borders, is not taking place anymore. But we understand, of course, that countries have a responsibility to fight the pandemic, and quite sensibly are taking very stringent measures at containing the contagion. And so we support the primary responsibility of saving lives across governments in Africa. When the conditions allow, we will resume our work and we will re-energize our efforts in implementing the African Continental Free Trade Area.
Now, surely even after this pandemic has passed one day, there's still going to be a lot of caution among countries about the free movement of goods and people. How are you preparing for that?
Well, we are working closely with the African Union Center for Disease Control and Prevention, and they are working on establishing protocols for how eventually people will be able to move across borders in adherence to those protocols that are going to support public health in Africa. From the side of the African Continental Free Trade Area, we will have to continue our meetings. We will have to continue engagements using a range of tools at our disposal, using or applying physical distancing protocols as advised by medical professionals. So I think we will have to balance continuing our work at the same time with adhering to public health protocols. I will say that at this moment, the African Union, ourselves, the Secretariat, we have proposed to governments in Africa to establish trade corridors, which will enable the movement of essential goods across and through transit, through borders. Even at this time, when borders are closed, it's very, very important that essential goods that are critical for fighting the pandemic, soaps, germ-killing products, it's essential that they are allowed to transit through borders. And so at this time, we're working very closely to ensure that, that those corridors are actually operationalized, and these essential goods, that they reach people that they need to reach across landlocked countries in the African continent.
And in terms of how you're going to tackle this, surely, how much has this COVID-19 pandemic set back your ideas? I mean, you're currently in Addis Ababa, you're on your way to the headquarters of the African Continental Free Trade Area in Accra, Ghana, when everything shut down. How far back do you think it's going to set your plans?
Well, I have had to reprioritize my plans and my what I had intended to do at this point of having been sworn in on the 19th of March. What was a priority before COVID-19 may not necessarily be a priority today. It is only sensible to do so. I now will have an added focus on industrial development and developing a very clear strategy for industrial development in Africa, so that some of the challenges that we have identified because of COVID-19, we're able to overcome them going forward. For example, the question of imports of personal protection equipment, imports of all of these essential medications for fighting the pandemic. We need to develop a strategy, an industrial development strategy for added, value-added production in Africa, for manufacturing in Africa. So we need to establish very, very rapidly these regional value chains for industrial development in Africa, and we need to do so not only to fight this pandemic, but going forward, we know that there may be another pandemic, so we have to be prepared from an industrial development standpoint. Second, intellectual property rights has now become a new priority. So we have to review and relook at our intellectual property rights regime to see the extent to which it enables us as Africans to develop a generic drug industry in Africa, a generic drug industry that will assist us and facilitate access of all our peoples across the continent, facilitate access to decent and reliable healthcare and affordable healthcare. So we need to relook at our patent system and see the extent to which our patent system enables the development of a generic drug industry in Africa. So I think these are areas that may have been there as priorities before COVID-19, but they have now risen up on the agenda to take account of where we are in the economic development space of Africa. But we are very hopeful that at the right time, we will be able to resume our work, and that this African Continental Free Trade Area will actually be the economic recovery plan that the African continent requires. We don't have the benefit, unlike many other countries around the world. In Africa, we do not have the benefit of substantial stimulus packages. The US has a stimulus package of over $1 trillion. They gave to the airline industry a $60 billion bailout in the form of grants and loans. Air France was given $7 billion. The European Union is providing also substantial stimulus package of over $500 billion. So these measures, which are intended to re-inject growth and dynamism in the economy, that are in the form of monetary policy and fiscal policy, many countries in Africa don't have the luxury of these tools. And so this is our only hope, implementing this agreement and boosting intra-Africa trade as a driver of economic recovery is really the only tool that collectively as Africans we have post-COVID-19 to re-inject dynamism in growth in Africa, which, as you know, was set at about 4% per annum on average for this year, which now, according to the World Bank, will be reduced by almost 5% by the end of 2020. We also know that the services sector in Africa will suffer the most. The airline industry, the services sector is set to lose between 20 to 30 billion dollars this year, by the end of this year alone. So the recovery has to happen very quickly on the back of the African Continental Free Trade Area as a new driver of growth from 2021 onwards.
Then there is the March of Women on this continent to think of on Africa Day. What better person to speak to than the former Deputy President of South Africa and current United Nations Under Secretary General and Executive Director of UN Women, Mlambo-Ngcuka.
In the world today, there are two strong regional organizations, the African Union and the AU. In the United Nations, for instance, Africa is about 25% of the countries that make up the United Nations. So we need to celebrate the extent to which, as Africa, we can coordinate our efforts and speak with one voice. We've also been able, with the formation of the African Union, to take common positions on issues that are critical for Africa. But right now, the fighting against coronavirus, Africa is actually able to coordinate its effort. We have a strong leadership in President Ramaphosa, and all of those things, we should not take them for granted. It's important to protect them and to use them to advance. We have now a continental free trade. That, again, is a major achievement.
And in some ways, this is a big test of African unity and cooperation, this COVID-19. I mean, it's put tremendous strain on every government from here to the Mediterranean Sea.
Yeah, no, absolutely. And the fact that African cooperation is about opening the borders. To fight COVID-19, we had to close the borders. We now need to see how are we going to stay coordinated, collaborative, despite our borders being closed. And that brings us to the digital infrastructure that the continent needs so much. It has been shown that without that infrastructure, many of our children cannot learn. There are about 56 million children in Africa who don't have access to digital infrastructure. So our coordinated effort in COVID conditions means we have to rebuild our economies in such a way that such infrastructure is available in Africa. And of course, the sharing also on resources such as PPE, that is important. How could we procure in bulk so that we are able to serve as many of our countries as possible? I was glad to hear yesterday that 44 countries in Africa now have a testing capacity, something that we did not have. Only about 4 countries were able to test within their countries at the beginning of this crisis. And all of this has come about because of a coordinated effort. And of course, the positions of women in this continent is also very important. This year, we have got about 22 elections in Africa. We want to make sure that Africa also stays true to its women, that we support the participation of women in the political life of Africa.
And just to touch on something that you mentioned earlier, the African Free Trade Area, it's almost upon us. There's a lot of hopes for it, but surely the post-COVID-19 world, whenever that will be, is going to be a severe test of this. Surely it's going to become a lot more expensive and a lot more complicated to open up the economy to the economy of Africa to trade.
Yeah, no, absolutely. And that is why I'm saying that we have to make sure that we don't waste crisis. This crisis has showed us the importance of infrastructure. We need, therefore, to provide this infrastructure because that's the future. Crisis or no crisis, we were always going to have to deal with the fact that we need much better connectivity for the continent. This is the same thing about infrastructure such as water and sanitation. We should make sure that we are providing water and sanitation to underserved communities, not just to survive COVID, but for the long haul, because this is what our communities deserve and need. This is what the Secretary General of the UN calls building back better. Our new normal must not be like the status quo that we find in the old normal. It must be something that is better. Our growth must fight inequality. Our investment in women must fight gender-based violence, and we must do this intentionally. Our infrastructure must make sure that there are more children who can access learning online, at home, in times like this.
And that's one of the great problems that's been mentioned by the World Health Organization even during this crisis, that children, a lot of children in the areas across Africa don't have bandwidth, they don't have the infrastructure to learn online like a lot of luckier children in the bigger cities in Africa. What do you think can be done about that?
Well, we need partnership with private sector. This is one area where governments cannot work alone. There's a need for joint efforts by private sector. We are seeing examples of that happening, but not at the scale that is required. So we need to push in order to make sure we leave no children behind. And in any case, it's not just about addressing education. It's also about addressing the new forms of work that are going to emerge after COVID, preparing people for work that will be mechanized and making sure that they will find their place in that new area of work. But also I need to highlight the fact that as we do that, as we have more people becoming connected, we also need to address the confusion that is caused by fake news. And now in times of COVID, where there's a lot of fake news that threatens the gains that we have made in health, that is making vaccines in general to be seen as problematic rather than a public health good. As we bring people online, we need to have ways of making sure that the information they get is helpful and is useful. And with COVID especially, we need to address this because there's a lot of misinformation and fake news.
And lastly, and very briefly, what is your hope for Africa in these difficult times?
Well, I am hoping that Africa will put its women front and center of all the responses, whether it is addressing peace and security, whether it is addressing our health crisis. We've seen during Ebola the role that women played. I also hope that Africa will be able to silence the guns. This has been something that we've been fighting for a long time. And I'm glad that now, as you know, many countries in Africa are having elections at a time when they're supposed to have them without wars and coups that we used to see. But we're not there yet. We still need to do more.
That's it. Plenty of food for thought there from across the continent, around the world, how this continent is going to tackle and beat this COVID-19 pandemic. From me, Chris Bishop, on the CNBC Africa Day special, it's goodbye.